Good morning, everybody, and welcome to the Brenda Perryman Show right here on TV 33 WHPR. And you're not to miss this show because we have so much valuable information for you today. And we're going to start off, and it's kind of a cold day, but if your heart is warm, you don't really feel it like that. But we're going to start off. I have a guest, Mr. Joseph Kimbrough, who is going to just dazzle you with job opportunities, job training. We're going to talk about customer service and so forth. And then the second half of my program, we're going to have Erica Hill, and we're going to talk to you about registering for the Affordable Care Act, or what some people call Obamacare. I don't care to call it that, but that's just me. That's the way I kind of roll on that. So, um, I think you need to stay by the television. We'll have a quick break. Then you can run, get something to eat or something like that. But I need you to listen to what's happening because this is very, very important information for you. And I'd like to first introduce my first guest, Mr. Joseph Kimbrough.
Well, first of all, I would like to thank you so much for having me here on your show. I'm just really just thankful today just for what you're doing here for the listening audience, just being empower them and encouraging them with tools to go to the next level.
Right. I mean, all of us are neighbors. All of us are neighbors. All of us may encounter one another, and there's certain skills that we need.
Exactly.
Also, people talk about jobs, and they're talking about the mayor, and he's not getting us jobs and everything. But there are a lot of things that we can do too.
Exactly.
Isn't that
Absolutely.
right?
Absolutely.
Now, let me tell you why I first got in contact with Joseph. I saw a story about Joseph. Joseph had written something on Facebook, but you'll just listen to that in just a moment. But first, I want to ask Joseph about his background. You were born in Detroit?
Yes, I was born in Detroit. I actually started off at Miller Middle School. That was my middle school. Went to Old Miller. Ended up going to Davis Aerospace Technical High School.
Oh, you went to Davis?
Yes, I went to Davis Aerospace Technical High School, and eventually I ended up at Western International High School.
Oh, Western,
Yes,
yes.
I ended up going to Western. I was senior class president at Western High School, and eventually I ended up going over to University of Michigan, where I studied electrical engineering, and then eventually I ended up getting my quality degree, and also ended up getting eventually my master's in engineering management, and now I'm finishing up my doctorates in education.
Oh,
So I'm really
wow.
excited.
Education, my bag, my
Yes.
bag. Well, Joseph, I read about you and read your story about how you had become unemployed. What happened? Can you tell us?
Well, was it 2009? I was actually working at Chrysler Corporation, actually into 2008 and 2009. So I actually was unemployed at Chrysler. When I got unemployed, my boss basically, he called me. He said, got laid off because of the bankruptcy. So he calls me and said, Joseph, he said, where are you? I said, man, I've been unemployed. He said, what? He said, I'm looking here at your desk. He said, no one told him. I said, no one told you I've been unemployed? I said, yes, I've been unemployed. He said, are you okay? What can I do to help you go to the next level? I said, man, I am great. I am fantastic. I'm excited about what God is about to do in this hour. And so next thing you know, he like, I'm supposed to be here encouraging you. You encouraging me. And so the next thing I know, I end up going to Michigan Works. And so I got to Michigan Works and I saw all these people, they were in line.
Now, you went to Michigan Works to get in line? Or
I was going to Michigan Works to get in line to file for unemployment.
Okay.
I lost my job. I said, well, my wife was like, well, you got to go to Michigan Works. I already knew to go to Michigan Works. So I ended up going to Michigan Works to file my unemployment. And so as I was sitting in line, everyone was all depressed, upset, stressed out about life. And so I started empowering them and encouraging them. Saying, aren't y'all excited about going to the next level? Aren't you guys excited about the new move of God? Think about it. If they just unemployed, you just got laid off, I mean, God got to be about to do something great in your life. So next thing I know, the lady from Michigan Works, the manager, she comes out saying, excuse me, sir, these people here are just depressed. They upset. She said, what is going on? She said, she said, what's the name of your company? I said, actually, I went to her office. I shut the door. I said, God gave it to me a long time ago. Sensible Business Consulting Group. We make business make sense. She said, can you put together some training programs to help the no worker left behind people go to the next level?
So you were in the unemployment line, and they saw the way you communicated with the other people.
Yes.
And because of your enthusiasm, because you were lifting their spirits, they wanted that as a part of their program.
Absolutely. She said, could you put together some training class to motivate and encourage the no worker left behind? Because we have a major issue here, and they're not getting, stepping up to the plate. So what can be done? So I went to her office. I said, no problem. I'll put together some training classes for you. And next thing I know, I go home. I rush home. I'm so excited. My wife said, did you put your unemployment in? I said, oh, shoot. I forgot to put my own unemployment in. And so next thing I know, I go back to her. I ended up doing it online. Next thing I know, 2 weeks ago, I end up coming back up there. 2 weeks after I talked with her, because I went and got some people just like yourself saying, listen, we got a great opportunity to help the no worker left behind go to the next level. So when I end up going back, next thing I know, the welfare reform folks was in there. And I said, oh, my God. They said, Court. They said, who is this young man? She said, baby, what's your name again? I said, Joseph Kimbrough. She said, oh, yeah, he got a company called Senso Business Consulting Group. And they're going to be helping us put together some training programs to help our no worker left behind. He said, hold on, baby. You holding out on me. I need something for the welfare reform. He said, listen, I need you to put together some programs for my people to help them go to the next level. So my welfare reform. Could you put together some training classes to help them go to the next level? Yes. And so I said, oh, no problem. And so I went to my team. I started getting different people together, saying, what were some of the things that helped the no worker left behind and also the welfare reform?
Now, your team, it was made up of?
Well, basically, it was me and a couple of guys. We used to all work at Chrysler together.
Oh, okay.
And they actually had a buyout. They took buyouts. I got laid off because I was contract. So they had like a little crunch. My buyout was bridge guard. You know what I'm saying? It was like Medicaid. You got to do what you got to do, right? And so my wife always said, I can't believe your TV said it. But at the end of the day, I didn't have a buyout. You know, I didn't have all those kind of things.
But you really had a buyout.
But I had a buyout
Yes.
because I'm encouraging them, saying, "Cause y'all want to help me take the no worker left behind together, you know, to the next level." So they said, we'll help you and support you because we already had our backgrounds in engineering, quality management. These are some of the things we were doing already for years, helping people. And so we started putting together some programs for the no worker left behind, as well as for the welfare reform. But while we were in there, we came back to do the presentation. So now I'm presenting to the young ladies and the managers. Their owner comes in. And as she was coming in, she just really was dropping a piece of paper off to talk to her managers to let them know what was going on. So next thing you know, they wanted to introduce her to myself and my team. She said, excuse me, hold on, don't you leave out the door. I want you to introduce you to Mr. Kimbrough and what's the name of your company again? I said, Senso Business Consulting Group. Wow. She said, oh yeah, Senso Business Consulting Group. They're getting us together some programs for the no worker left behind as well as for the welfare reform. She said, well, baby, I'm really not interested in that because I'm really trying to deal with the foster kids. I said, really? I said, I was in a foster home. I said, I've been in a foster home for years. And she said, you were? She said, come in my office. I would love to talk to you because I told her I was doing some things with leadership development already and helping youth. So we go in her room. We had such an awesome time. I think we stayed there for a whole hour. Next thing I know, she said, I have a contract for you to start this summer.
My goodness.
And she said, I need to be able to empower our people to go to the next level. Right. She said, I have a contract for the Highland Park area as well as also for the Wayne Westland. Could you help us?
Isn't that wonderful?
To go to the next level.
Embarrassment of riches. It all came from just your continence, your belief in God.
Absolutely. And actually doing what you've been called to do, to empower, to encourage, even though I was going through my own storm. But I didn't look at it as a storm. I looked at it as an opportunity that God was going to show us.
The Chinese have one word in it. You could either go for opportunity or disaster, and you chose opportunity.
You know what? And that's what it's all about. Looking expectation of what's going to happen. I believe that when you being obedient, God will order your steps. And then my thoughts is this here: if God allowed things to happen when it's out of your control, there's nothing you can do. You've been faithful. Then evidently He must have a plan. Because I was faithful to Chrysler. I just had a performance review. That's why I was kind of shocked. I just had a great performance review, and so so you think about laying off? He like, no way. He was shocked. And so my thoughts were saying, how can we empower people to go to the next level? So not only did we end up getting a contract for No Worker Left Behind, we ended up outsourcing the whole department. So those individuals who signed my paperwork to go through different programs, I end up outsourcing them, to empower them, and encouraging them, giving them tools for success.
So tell me this. You got these programs going on. What kind of results have you seen from them?
Well, actually, the results is one of the biggest things for us when it results was customer service. What we found, though, that there were so many people that did not have the skills, the soft skills to go to the next level. We had to actually put together programs to help them go to the next level as customer service and to get employed.
Explain to the audience about customer service.
Well, customer service for 2018, even now, is the #2 job in the state of Michigan. of all jobs, the top number 2 job is customer service. So our job function, and we didn't even know back then how important it was, but even now, it's still important. And so our job function was empower them in customer service to get them back in the job arena. And it was just so funny. You saw my results. We trained, I'll say, over 2,000 individuals in customer service. And many of those individuals, I'll say about
what jobs did they get?
Customer service jobs in medical field, because many of those individuals, just because you have a CNA, right, certified nurse assistant job, they need to have people skills, the soft skills to deal with conflict resolution, how to handle yourself, how to carry yourself, how to deal with your emotions.
Well, don't you think too, those people, they impact the company. Your customer service skills impact the company, because if you don't give me good service, I'm not coming back to that company.
Absolutely, because there's a difference between customer service and customer loyalty. What's going to patronize your people? What's going to make them want to come back year after year?
Right.
And so we had to give them the skills to be able to, what the employers were looking for to be able to keep their business going.
Right.
You know, it's one, and then also think about first impressions, how to deal with conflict resolution, because leaders are not born, they're made. So we had to train them and give them the skills that they need to go to the next level. You know, talking about what's empowerment, why people fear empowerment when it comes to customer service. Because they think if somebody get empowered, they're going to take over the whole division. You know, they think about empowerment, when you think about customer service. When you go to the dollar store, you only have $1, right? Why would I go to the dollar store? I have to sit there and wait on the manager to refund one item of $1. But you can go to Home Depot, you can go to different stores without even a receipt, and that person has been empowered to be able to refund certain things even without a receipt to give you store credit. So why do people fear empowerment? So that's even dealing with customer service.
Wow.
So those kind of things are really important to the workforce development even now. But just going back to that there, not only did we end up getting the contract, look at this here, God is awesome. We end up dealing with this here, look at this, the No Worker Left Behind contract. We end up dealing with, remember, we started with 2009, the first month. Notice this here. That's customer service for all the No Worker Left Behind. Then we ended up doing the welfare reform for Michigan Works. Look at this here.
Resume writing workshops, resumes with a twist and innovative resumes.
Absolutely.
Wow.
Yep. Wow. Here go. Look, we end up doing the ones for the No Worker Left welfare reform, teaching them entrepreneurship, customer service, teaching them construction management.
Tell us a little bit about teaching them entrepreneurship. What kind of what do you do to encourage a person to be an entrepreneur?
Well, one of the things how we encourage them to be an entrepreneur is trying to figure out what's your vision, what is your purpose first of all, you know, or
what you're good at.
What you're good at. What are you good at? Because the reason why we came up with those particular courses like customer service, entrepreneurship, and construction management. Think about it. Many people were coming to Michigan Works because what? Maybe they lost their job, right? Maybe they came out of prison. So how can you get those people back in the workforce? Because you have a record, then many times you can't go and get a job because you may have like a felony on there. So we can help those individuals go to the next level if they have a skills in what? Think about janitorial work, right? Or you think about quality, sorting parts. And so we try to build them with the tools to figure out, first of all, what you've been called to do. What is your vision?
Right.
So that was the biggest thing we did with Michigan Works, is to get people to understand their purpose, their vision, their personality, and to find out what does God call you to do and help them define that.
Okay, if you have a call, you could call us right now. Right now, I think I see the light going on. And so if you have any questions, because we're always talking about jobs, and that is so very, 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 very important.
Well, it's funny you say jobs. When I
say careers.
Well, careers. Think about this here. When I left Chrysler Corporation, I ended up getting, first of all, I was part of No Worker Left Behind. They ended up allowing people to go back to work who made under $40,000, right? If you made under $40,000, you can go back to school with about $5,000. You can go in any particular area you wanted to, right?
Okay.
So not only they have that service, but many people didn't take advantage of it. And not only they did not take advantage of it, they did not even complete. Many people started, but they didn't finish.
Oh.
They even had the program called the TAA, those who in transition, who lost their job in the automotive industry.
Yeah.
By God allowing, see, when one door shut, see what I'm talking about? God ended up opening up the door where they ended up paying for my doctorate program through the TAA program.
They did.
They're paying for it as we speak.
Oh, my gosh.
And those are the kind of opportunities that we have to talk to.
Charlene is on the line. Good morning, Charlene.
Good morning, Ms. Perryman. How are you?
Just fine, thanks.
Yes, ma'am. I have a question for your guest. The first thing is the name of his company, and then how can I get in contact with him? Because I was just talking with my husband this morning about something similar, so I got excited.
Well, actually, the name of my company is called Sensible Business Technical and Leadership Institute. You can reach me at 248-973-7221. That's 248-973-7221. Also, you can check us on our website at www.sensible, that's SENSIBLE, business, BUSINESS.org. So that's one word, sensiblebusiness.org.
Okay, thank you.
His name is Joseph.
Joseph Kimbrough.
And I'm Charlene Muhammad, Mr. Kimbrough, and you have a great
Oh,
business and
hey,
have a great day.
Charlene, how are you?
You have
I'm great, sweetie.
And you know what? And see, my thought is God will make room for your gift. Whatever God has called you to do, He will make room for that. And it's one thing if you trying to just make some things happen, but sometimes you have to allow your footsteps to be ordered, not trying to make things happen. So just like that day, just going there and empowering them. So next thing I know, it went from the Michigan Works, Wayne. Right, they said we love what you're doing. Ended up going to Livonia. Now I had ended up getting a contract with Livonia Michigan Works office. Ended up getting a contract with Highland Park Michigan Works. So I ended up doing all their leadership development training. So they were busting me in from Highland Park all the way out there to our location in Westland. So now we done stretched out. Then next thing you know, we ended up doing the AmeriCorps Vista. They got heard about what we were doing. We ended up doing the whole state training for the AmeriCorps Vista individuals, helping them go to the next level.
Training?
Well, the training was called, some of the training was called Networking for Success, our leadership development programs. The other one we have called Resumes with a Twist, how to pull things out of individuals they can't see within themselves. Like a great example would be, imagine if you worked at McDonald's and you sitting there saying, I hate working at McDonald's. Why would I do it in workforce development? They say, I hate working at McDonald's. And I said, why do you hate working at McDonald's? Because they always putting that sign out. You always have me out in the yard and doing this stupid stuff. Let me tell you this here. If you put that sign out in the yard, because McDonald's always have different things. I'm not trying to promote McDonald's or any other corporation, but imagine you at a store and you keep putting those different advertisements out in the window, right? And you sitting there every day because of new coffees or whatever McDonald's going to offer. Do you not know that's assisted management and marketing advertisement? Assistant management and marketing and advertising.
It is.
A safe, it's changing your perspective on life. Think about this here. Imagine if you were sitting here and you working at McDonald's and you cleaning the restrooms, right? And you say, I hate cleaning these restrooms. Well, first of all, you put on your resume any. So don't get mad when they sit there and get mad. You say any, so they gave you any job. It's called hit those bathrooms. But imagine over the years, you start training 10 or 20 people, right? Train 10 or 20 people on how to improve what? Customer service. Or train over 20 people, whatever, in customer service. Because that's all about what? Customer service. Imagine if you came to McDonald's or Burger King or wherever it may be, or even here, and you say, you know what? Think about this here. You come to the restaurant. You say, oh, I'm trying to cut down on my weight. All I want is, I'm trying to salad. Would you like any coffee with that, right? Think about over a time period. That's improved sales by how much? See, it's all about changing your perspective on life, and that's what we do. We pull things out of you that you couldn't, do with, see within yourself, and that's what it was all about. Just like going to Michigan Works, it was about pulling things out of them that they didn't see within themselves when they were depressed and upset and stressed out.
Now, Michigan Works, what about some of my unemployed viewers? What would you advise them to do right now?
Well, right now, one of the things I would advise you to do, I would advise you to go to Michigan Works or Workforce Development due to the fact they have tons and tons of programs out there to help you be able to sharpen your skills. When you're looking for a job, it becomes a full-time job. I believe this here, that sleep is for broke people. So if you have to burn the midnight oil, whatever you have to do, then you do it because guess what? Every time you think about going to the next level, think about this here. Soon as people start reading a book, they start getting what? Sleepy, right? And so every time you talk about going to next level as far as studying for a job, studying for a test or whatever, if you don't burn the midnight oil, you will not be able to realize greatness within you. So that's the important thing, is giving people the tools necessary, and that's what one of the things that Michigan Works do, and that's one of the things they see that we do.
It's funny, in the movie Wall Street, Michael Douglas's character calls up Charlie Sheen's character and says, you were asleep? He said, money never sleeps.
That's right.
That's right. Money never sleeps. Now, let's quickly talk about this book, and you have another book coming out.
Well, actually, this here book is called Game On, Tools and Strategies to Living on Purpose. The tools and strategies to living on purpose, because many people in this hour do not have the tools to go to the next level. Just like the caller called in and said, you know what, I'm trying to go to the next level. I was just talking to my husband. Some people need the tools and strategies how to obtain greatness. Right? And so I believe in the 5 E's of success: engage in conversation, equip you with the proper tools. We empower you to make the right decisions. Once we empowered you to make the right decisions, guess what? We've elevated you to the next level. And then in the book, we also encourage you to stand alone, because everyone's not trying to go to the next level. Everyone's not trying to do what you're doing, because we are all uniquely and wonderfully made. And so that's one of the things we do. We work also with Detroit Area Pre-College Engineering Program. I have a program, DAPSEP. I'm actually tomorrow I'll be with DAPSEP, because I put on a class with DAPSEP called Game On, Maximizing Your College Experience, teaching students how to go to the next level, teaching students how to not only get into college, but how to stay in there. Because when you think about college, I mean, think about this. They say 80% of our students say is not college ready based upon the ACT, right? We've been having such a huge dropout rate like never before.
Right.
And so our students need the tools to be able not just to get in college, but how do you stay? How do you maximize the finances and resources? I was talking to the University of Michigan, Dearborn, I'll be totally honest, and they were saying that not one African American graduated with anything of science, technology, engineering, math last semester. So is it a math problem? No. People need tools for success. And so we're putting together programs like I did right now with Oakland Community College, working with them. I'm called the STEM intervention instructor, teaching them students how to go to the next level, seeing greatness within them, showing them how their personality has an effect on their outlook on life. You know, and so that's what it's all about. So this here book basically give people tools to go to the next level, how triumphs realize, how to overcome different obstacles, how to be able to get the tools and the resources you need to go to the next level.
Handling emotions and strategies for handling negative emotions. These are things that are very, very important. Perfect phrases when others' work habits disrupt you.
Absolutely.
I mean, the things to say, to handle yourself. It's all about handling yourself. And I remember when I taught, I taught drama, but I also taught speech, public speaking, and we always did simulated job interviews
Absolutely.
with the kids that young.
Yes.
Someone played the employer, the employee. We showed them how to do their application, their resume.
Oh my goodness, it's so funny you say that, because the governor's put on this new program called MAT Square program, right? They have where basically trying to help students go to the next level. I think it's people go to the next levels in the technical field. But the bottom line is, they said it's not about just your accomplished score. It's about first impressions. It's about your portfolio. It's about how to be the the elevator speech, having that 30 seconds, exactly, having that 30-second or less elevator speech, in 30 seconds or less. How can I help you go to the next level?
A lot of times it goes on how they like you. I mean,
seriously.
That's the first thing.
That's critical.
That's the first thing.
Critical.
Well, I got to have you back again, because we have another guest on to talk about the Affordable Care Act, which is always important also. But this is just remarkable. Will you come back?
I would love to come back.
Because we have so much to talk about.
Yes.
Can you give your whabsite and
Well,
everything again?
if you're interested in any particular classes or training, our website is www.sensiblebusiness, that's SENSIBLE, business, BUSINESS.org. That's one word. Or you can call us at 248-973-7221, and we'll be able to give you the tools necessary to be able to realize your dreams, be able to take your whatever God has called you to do to the next level. Even if you want to order the book, we have a book release party actually at Eastern Michigan University called Living on Purpose. That's going to be April the 12th at Eastern Michigan University in Livonia, and it's going to be at 12 o'clock to 2. And so we're going to invite you out so you better get the tools necessary to realize your dreams and to take your life to the next level. If you ever thought about starting your business, you basically can reach us, and I'll be able to help you even go to the next level within that. It's to the point, I'll be honest with you, woman of God, we've written the curriculums for to help students and teachers go to the next level for Henry Ford Academy, so at the Henry Ford Museum. We end up writing the curriculums for Chandler Park, working with them. Miss Christmas. I trained all her teachers.
Her daughters too.
Are you serious?
Yeah.
I train all her teachers how to go to the next level, because they teach a course called The Forum. And so we train the teachers to be able to give students everyday tools how to go to the next level.
Wow, tremendous.
So I'm just really excited, because
You ought to
we
be.
have to give our tools. What I decided to do was I took all the workforce development training and also the conflict resolution skills, and we put it in book form called advisory, where they could teach the students every day, Monday through Friday. Old Redford Academy, inside Old Redford Academy, we train 56 teachers how to utilize our curriculum. We have a curriculum for 9th graders, 10th graders, 11th graders, and 12th graders, giving them the tools to realize their dream. Why do they have to wait till they go to Michigan Works? Why do we have to wait till they go out, graduate and don't have the tools to realize their success? So when you talk about results, improve the grade point average, the culture, the training of the teachers, how to deal with kinesthetic learners versus what? Abstract learners.
Right.
So those things are important.
I'm abstract random.
Don't start no stuff.
Yes. Okay, everybody. We'll be back in just a moment. I want to thank you.
Thank
We have
you, thank you,
Erica
thank
Hill
you.
on to talk about the Affordable Care Act, and you need to hear about that.
Absolutely.
Good morning again, and welcome again to the Brenda Perryman Show right here on TV 33, WHPR, Comcast 20 in Detroit, and over the World Wide Web. And, of course, we have the app for the phone. But I want to tell you that a deadline is coming up soon, and my guest is going to talk about the Affordable Care Act, and this is Miss Erica Hill. Good morning, Erica.
Good morning, Brenda. How are you?
Oh, I'm fine. We have our challenges, but I'm just fine. I'm doing, God woke me up this morning.
Absolutely, he did.
He did.
With
He
intention.
did.
Yes.
And Erica is a friend of the show. She's been on the show before
Yeah.
for Obama.
That's right.
Yes, trying to get him in. Well, now we're trying to make this Affordable Care Act a success.
That's
right?
correct. That's right. So we know that the president has initiated the Affordable Care Act in 2010. We also know that we came with a lot of opposition from the other side of the aisle, and they continue to oppose the Affordable Care Act. And what we need to do to ensure that they cannot repeal it or give us any more flack about it is to make sure that we enroll. And so the enrollment deadline is March 31st. It's March 31st.
Yeah,
For
a
coverage.
month away.
That's right, for April the 1st. And so we want to ensure that people have all the information that they need to ensure that they are getting affordable health care.
Okay, now here's my question. If they don't register by the 31st, when is the next time they can?
The next time is November 15th.
Wow.
Unless they have a situation that comes up, if they lose their job or they have a child or they have a life-changing circumstance. Outside of that, the open enrollment process does not begin again until November the 15th, until January of 2015.
Okay, let's dispel some myths, because some people say, well, this is more expensive than my other insurance, or why should I get this? Nothing's going to happen to me. People, insurance, a lot of people say, well, that's just in case stuff.
That's correct.
But in case can happen any day.
Yes, it can. So the Affordable Care Act gives it's a marketplace. And so what that does, it kind of levels the playing field for insurance rates and carriers. So everyone's situation is different. So I can give you a couple of examples.
Okay.
I know of a young person that enrolled in health care. They had been previously without health care. They had an employment. They were employed, and they fell into the $28,000, $30,000 tax bracket. They were able to obtain health insurance for $15 a month.
15.
$15 a month.
How do I get
Right.
that? How do I get
But it depends on their life circumstances.
Okay.
So there may be someone else that's employed and they fall into a higher tax bracket. They may pay $100 a month or $200 a month, but for what they're paying for, generally they get more. They get more than if they were paying for an individual plan outside of the marketplace.
If you have questions about this, please call us. We'll be on for a little while longer. Please call us if you have questions about the Affordable Care Act. If you're leery about it, if you want to ask any kind of questions, 868-0342, 868-0351. So, young people, we want to get young people
That's correct.
involved.
So our target demographic are young African American men between 18 and 35 that are generally healthy, because that is the population that they don't think that they need insurance, and they don't think that they can afford it. Many of them, especially in our community, they may be self-employed. They may be underemployed. They may work at a establishment that does not provide health care, and their income is not that high. And so we really want to make sure that they understand that this is affordable and this is something that's necessary. You know, we're young and we're healthy today, but we don't know what happens
never know.
tomorrow. And there's a statistic, and I don't know all the exact numbers, but most of the bankruptcies in the United States happen because of
Health care.
That's right. And people have,
Healthcare, driving. I mean, the money.
that's right.
It's so expensive.
That's right. And so if you can get a health care plan for $50 a month or 30 cents a month or $150 a month, it clearly is less expensive than having to pay it on the back end. So we really
Right.
want to make sure that
And if you are a single parent
that's correct.
and you have a child, you know, childhood illnesses,
Yes.
they happen.
That's
I
right.
remember when my first child was, she was a baby. Every month I had to take her to the doctor because she had nasal allergies and she'd spike a fever to 105.
Yes.
And so we had to go to the doctor. But, you know, I had health care.
Yes.
We had health care,
Yes.
me and her dad.
So oftentimes that happens and we don't have health care. We have to bear those expenses or
Or go where they don't treat us right.
that's right.
Oh,
That's right. Or we go untreated because we're afraid to go to the doctor because we know that it's going to be expensive.
case in point.
Yes.
Someone in my family, not one of my children, but they're in extended family, 38 years old, has congestive heart failure,
Wow.
got it when he was discovered when he was like 33 or 32.
Wow.
And they found out, they said, how did he get this? And they found out they put him in the hospital for 2 weeks. Luckily, they had insurance because 2 weeks in the hospital alone,
That-
but they had to do a full everything to find out how he developed that. And they found out that when he was a child, he had a fever that was so high that it went untreated and it damaged his heart.
Wow.
So that has affected his entire life. So you never know. You know, these children get these fevers. People put the rag on, the this, that. Sometimes that fever, high fever, can damage a child's heart.
That's right. Or
Oh,
any
your
other
heart.
organs. Yes.
Your heart.
That's right. So it's important. That's a very good, important story so people can understand how important it is to seek medical attention. And if you have that health care, you have the opportunity now for women. You can have preventive treatment for free. I mean, it's part of the act that they cannot charge you for those services.
For preventative,
healthcare.
like
So if you go for annual exam, if you
mammogram.
get a mammogram,
Really?
yeah. So all of those things are involved in the Affordable Care Act, and there's also insurance companies are not allowed to discriminate, if you will, against pre-existing conditions. So I know of a young lady who's a very good friend of mine who had cancer. She had a cervical cancer, and technically the cancer, you're not cancer free until it's 10 years out. And so at any rate, she was unable to get health insurance after she had her cancer for 5 years because she had a pre-existing condition. And in December of 2013, she was able to enroll in Obamacare, and now she has an affordable health care plan that also is so affordable that previously, when she was unable to get health care for herself, she could get it for her children.
Oh,
That
really?
rate was higher than
Oh.
it is now for her and her 2 children.
Isn't that something?
So it's something that we want to make sure that people have the information about. They can go to the website, healthcare.gov, or they can call the 1-800 number, 1-800-318-2596. And there are navigators and people that are well equipped to walk everyone through the process and understand everyone's circumstances. In the city of Detroit, there are many partners that are working to make sure
Who
that
are some of these partners?
DMC Path to Health. They are actually having an event tomorrow. It's an enrollment event at King High School
Okay.
from 9 a.m. to 2 p.m. That people can come, they can become enrolled, they can find out information. They also are going to have a health fair. They can have health screens. They can get a flu shot. So all those things are happening on tomorrow at King High School, 3200 East Lafayette, from 9 a.m. to 2 p.m. And that's the DMC Path to Health that is sponsoring that. Some of the other entities are in and around the city. Henry Ford Health Systems are doing enrollments. We have Enroll Michigan, Enroll America, Blue Cross Blue Shield, most of the insurance providers.
Yeah, that's what I've seen some of the advertisements on television.
Yes.
I didn't even realize that when I saw Blue Cross Blue Shield.
Yes, because, well, it's advantageous for them to enroll people in healthcare because that's what they do.
Yeah.
But nonetheless, all those resources are available to us, and we have to make sure that we're utilizing what's available to us because we want to make sure that this act stays in effect. We don't want to give any opposition any reason to say that we did not take advantage of it because the president worked very hard, and it's his legacy as he leaves office. That is his legacy, the Affordable Care Act, just as Social Security was in the past. And
Yes,
those things. So
yes.
we want to make sure that we're doing our part, and our goal, the president's goal, is to get 7 million people enrolled in healthcare, and we're at 4. We're at 4 million. So that's nationwide. So we need to make sure that Detroit, we're doing our part to utilize the tools that are given to us and make sure that we stay healthy.
And a lot of young people may have a parent who doesn't have health care. I'm talking about this 18 to 25 who usually could stay on their parents' health care. Some of their parents don't have the
That's
health
correct.
care.
That's right.
And so they have to find something for themselves. Maybe is there any way they could sit down with their parents or even come to a health fair like it's going to be at Martin Luther King's tomorrow and find out, Martin Luther King, not his house, but the high school,
Yes.
to find out this information because you never know. And this winter, there have been an abundance of car accidents,
Yes, so
an
cold.
abundance of awful car accidents. And I lost somebody
wow.
yes, I lost somebody 2 days before Christmas. And the thing about it was a business owner in the process of getting ready to sign up. And
Wow.
then he had to go to, the ambulance took him to the hospital. And I just watched the way they treated him,
Yes.
I watched that, and it was just atrocious. So
Wow.
you never know what's going to happen.
You never know. And again, in our community, we often, that's just not something to talk about. We don't talk about insurance. We don't talk about
We
health
don't talk
insurance.
about it.
We don't talk about health insurance. We don't talk about life insurance oftentimes. And so we become victim to not having it. And so here is an opportunity for us to take control of our future, of our destiny, if you will, by enrolling in healthcare and ensuring that we can maintain a good quality of life. And so it's here for us, and we definitely need to make sure that we're doing our part.
And another thing, like if somebody says, well, I have to pay $50 a month, and the budget's already tight, but sometimes we can find out what we could do without. I hate to, tell people that, but sometimes, our health, if you don't have your health, you don't have anything because there are people with loads of money who've been sick and they cannot function.
That's right.
Because they don't have their health.
That's right.
And preventative health care is so important.
Yes. And I want to that point, I want to make sure people understand that it's based on their circumstances. So we don't want the costs to get in the way of the information because, it may be that my care is going to cost, I know someone that pays 11 cents a month. Because
Are you kidding?
There's a subsidy. There are subsidies that the government provides based on your income. So it's very reasonable to know that you may only pay 11 cents. Now, you may not. That's not everybody's situation. But you have to utilize the tools that are given to you so you can find out what it is that you are going to have to pay for your health care. So it's a small bit of time to take to ensure that you have the information that you need.
Yeah, my son and his wife, they tried to do it. He works for Houghton Mifflin, the
Yes.
textbook company, and she has a pretty good job in social work. And he said, we tried, we couldn't get on it. I think they may have made too much.
Well, they could get on it. So there's different plans, and so it just depends on, again, your
They said
circumstances.
they didn't qualify.
So they don't qualify for a subsidy. So they qualify for the insurance because it's a marketplace. So anybody can, pay for insurance, but they don't qualify for a subsidy. And so what that means as a reduced they qualify for a reduced rate. I am self-employed as well. Previously, before working for OFA, and I had to pay $350 a month for my health care. I pay that.
What's OFA?
Organizing for action.
Oh,
Organizing
okay,
for
I
action.
know.
Yeah.
They send me emails all the time.
Yes, they'll get you.
They-
But prior to that, I had to pay $350 a month as a single healthy person.
$350.
Yes, and so if I had enrolled in the marketplace,
Was that according to your?
it's just according to my health, and it had nothing to do with my income. It just had to do with I was an individual. I don't have any children, and so as an individual woman, because there is a certain penalty that's attached to being a woman, whether we realize it or not, in the healthcare system, because we have concerns that men don't have, and so our rates are oftentimes higher. And so that was my rate. I paid that for several years. But when the Affordable Care Act came into play, I qualified for a much lesser premium. And so just as a single person, so it's not that I wouldn't have to pay anything, but I would have to pay. What I would pay was a significant reduction.
So it was affordable.
It was affordable, and what I got in my plan was much better than what I was paying for before I actually did the research and found out what I would pay under the marketplace. So we need to take advantage of the information, find out what it is going to be. Don't let anyone else's story deter you. Don't let somebody say that I had to pay $1,000. That's not your situation. Everybody's situation is different.
And here's another thing: a lot of jobs are hiring people now, and they're not providing the health care.
That's right. And so that's underemployment if they don't provide you
Right.
insurance. And so that's why the marketplace, the Affordable Care Act, is in place to make sure that everyone has health care. There is a penalty if we don't enroll in health care. If you're not insured in health care by the deadline, there is a $96 penalty for the first year that will be imposed on you.
Explain that again. How do they know?
When they file their taxes, there is a question on your income taxes that ask about your health care, and if you are not insured, then there is a penalty that's associated with it. So
when does that start?
it starts this year.
This year?
Yes,
Oh.
yes. So we want to make sure that people have.
You hear that, everybody? We wait for that check.
That's right.
If you're going to get one, you wait for that check.
Right. So it's just easier to do it the right way, to find out the information, and I think that people will be pleasantly surprised, depending again on your income and on your life situation. There is a Medicaid expansion that's taking place here in Michigan as well.
Tell me about that.
That doesn't start until April the 1st. That's when they
What
actually
does
roll
that
out.
mean?
That means anyone that will qualify for Medicaid, if you don't have employment, you have a very little income. Right now, you may not qualify on the marketplace because you don't have an income that will sustain you making your premiums. So if you don't have that income, you will qualify for Healthy Michigan or Medicare. And so that rolls out in April. And so there are many people that come in and inquire about the Affordable Care Act on the marketplace, but they don't qualify for it because they don't have an income. So if they don't have an income, they have to wait until April, and then the Medicaid expansion is going to kick in, and they will have an opportunity to
so
enroll
they'll
at that point.
be able to get on Medicaid.
That's correct. I'm saying Medicare. Medicaid, yes.
Medicaid.
That's correct.
Uh-huh.
And so, again, you still have options. You have the opportunity to be enrolled in different plans, but it's going to fall under the Medicaid umbrella or Healthy Michigan.
So, what about people who have Medicare? Medicare is their major insurance.
Yes.
And their other insurance is their supplement.
Yes.
Or supplemental.
So for those situations, we advise to call the 1-800 number. I'm not an expert on it, so I don't want to give out misinformation. Call the 1-800 number, 800-318-2596, or go to healthcare.gov, or come to one of the enrollment fairs that are happening in and around the city, one of which is tomorrow at King High School from 9 until 2. And one of the counselors can walk them through that process and give them all of the information that they have regarding their Medicare and their supplemental income insurance information.
What about a person who may have a cough, a persistent cough, and they said, well, it'll be over, but it's been going on 2 months, and they're scared to go to the doctor? a lot of times people are fearful. They're fearful about the doctor, especially men.
Yes, they are, because it's not like much. It's not hip or whatever to go to the doctor. But we know that it's so very important.
I mean, yeah. What if they are afraid to go to a doctor? They haven't signed up for the act, and they decide to sign up for the act.
Hmm.
They can just. How long does it take them to get the act?
So,
Get the medical insurance.
So if you are enrolled by March 15th, your coverage begins on April the 1st. So and that applies to any open enrollment time period. So in November, if you're enrolled by November 15th, you're covered December the 1st. If you're enrolling by December 15th, you're covered by January the 1st. So if they go in today and they enroll by March 15th, they'll have coverage by April the 1st.
So I got a cough to April the 1st.
Yeah.
You got to cough on,
So if you had it this long, hopefully you'll be okay until April the 1st.
So what if they sign up March 31st? When will it take effect?
April the 1st. They're ensuring that the deadline is March 31st for an April 1st start for most people's insurance.
Oh, okay.
Yes.
That's good. We have Sandra on the line. Good morning, Sandra.
Oh, no, it was Francis.
Francis.
Yes.
Oh, sorry.
No,
Sorry,
that's okay.
Francis.
I was wondering, people who don't get this insurance, and you said they're going to be penalized, and like I was telling the operator, so many people are angry at Obama, they won't care, and if they don't get it, what happens to them then? If they don't pay the penalties and stuff, what happens?
There's the penalty is imposed. I mean, no one's gonna come and get them. But the point is not so much the penalty. The point is to ensure that people are getting covered. And so there's not going to be a insurance police that comes and get people.
That's what I'm saying. That's why a lot of people probably won't care and they won't pay the penalty.
Well, we know that there's apathy, but again, we want to make sure. What we want to do is push the information. So what we do when there are people that are discouraged, we just want to give them the information and the tools to have them not be discouraged. There is a penalty that's imposed, and I understand some people will say, well, I'll just pay the money. I don't need insurance, and when I get sick, I get sick. So we want to change the mindset in our community. Unfortunately, that exists, and so people like you and myself and Brenda and the folks that are informed can use the information that we have to push back and say, this act has been imposed for our benefit. We have gone for uninsured for so many decades that this is the time that the president has enacted in a law that says that everyone has the right and the access to health care. So I try not to focus too much on the folks that say, well, I'm not going to do it because of this, that, and the other, but to give them the information and let them know that if they utilize the tools, they'll be better in the long run.
Right. Okay, well, thank you. I was just always wondering about that question.
You're welcome.
Thank you, Francis.
Thank you. Bye-bye.
And I was thinking, and a lot of people don't think about this, that the way that you're treated
Yes.
is, I hate to say, but insurance has something to do with the way you're treated by doctors, by the hospitals.
That's right.
It just does.
That's right. We often, see where people receive substandard care because, some of our, federally funded healthcare systems have to accept people regardless of if they have health care or not. However, we know the treatment is not always fair and it's not always equitable. And so we want to be able to